Bismillahirrahmanirrahim. Assalamualaikum and hi everyone. My name is Aina Farhana binti Sulaiman. Today, my group mates and I will be presenting a project of applied multivariate analysis entitled Study on Factors that Influence the Presence of Diabetes Among Females of Pima Indian Heritage using the logistic regression. Diabetes is a chronic illness that occurs when the pancreas could not produce enough insulin or a body unable to use the insulin produced effectively. A person who is not able to generate or use insulin sufficiently results in a high blood glucose level known as hyperglycemia. This occurs when elevated blood sugar is a typical result of uncontrolled diabetes and contributes to significant damage over time to many of body structure, especially the nerves and blood vessels. Globally, the number of diabetes patients had increased from 108 million in 1980 to 422 million in 2014. The presence of diabetes among women had increased from 5% in 1980 to 7.9%, where women and diabetes have serious problems compared to men. High risk in diagnosing of diabetes can cause women to experience several unique symptoms. Here are the research questions. What are the significant factors that affect the presence of diabetes among females of Pima Indian heritage? What is the logistic modeling to predict the presence of diabetes among females of Pima Indian heritage? The objective of this study is to determine the significant factors that affect the presence of diabetes among females of Pima Indian heritage and to develop logistic modeling in predicting the diagnosis of diabetes among females of Pima Indian heritage. For the next part, I will pass to Siti Aminah.
Thank you, Aina Farhana. The next section is literature review. This chapter covers the previous studies of the factors affecting diabetes and logistic regression analysis. It also helps the researchers to gain more understanding regarding the method used in the study. The first part is factors affecting diabetes. The study by Abdallah 2019 it said that diabetes is a disorder that is affected by certain factors related to the behaviors of the patient and the surrounding environment. The factors that are significant in the study are gender, age, and diabetes infection. The study also found that males were more infected with diabetes compared to females. The next study is by Maulana Badriah and Sharif 2018. According to the study, diabetes is a very serious chronic disease. Diabetes may occur when the pancreas does not produce enough insulin. And the significant factors in the study are age, hemoglobin, gender, blood sugar pressure, creatine serum, white cell count, urea, total cholesterol, and BMI. The second part is logistic regression analysis. The study by Abidin et al. 2016. Logistic regression is a very common statistical tool often used in analyzing health-related data. The mathematical concept of logistic regression is to express the relationship between dependent variables and independent variables in terms of logic. Y is a dichotomous dependent variable categorized as 1 and 0, and X is a continuous independent variable. The next study is by Rastogi and Singh 2019. The categorical dependent variable is categorized to 0 for not having diabetes and 1 for having diabetes. The study also stated that there are some assumptions need to be fulfilled to fitting a logistic regression. The study also uses various tests after estimate the coefficient to obtain the best fit model. The next part is methodology. Binary logistic regression is used to determine whether the patient have diabetes or not after the screening is done. The first part of methodology is research design and data. The research design for this study is exploratory research. The study is conducted to more understand the nature of problem, which is estimating the factors that affecting diabetes, and to know the outcome of diabetes among patients. Data of the study. Dataset is originally from National Institute of Diabetes and Digestive and Kidney Diseases. The data obtained is 768 samples. The data consists of 8 independent variables and 1 dependent variables. Next part is theoretical framework. This is the theoretical framework for this study. Next, I will pass to Nurul Hidayat.
Thank you to Siti Aminah binti Muhammad Salim. My name is Nurul Hidayat binti Kamsani. I will continue in methodology part in research flowchart. In our study, to conduct the research, for the first step is to choose the appropriate data which is suitable for the method. Second is to check the model assumptions. Next is to estimate the intercept and regression coefficient through the odds ratio. And the next step is to conduct the classification to know whether there is misclassification or not. And the last part is to test the goodness of fit, which are omnibus test, Naga-Kekal R-square, Cox and Snell R-square. Next, we go to the data analysis technique. We use some techniques to apply and to analyze the data. It also related to the logistic regression model. For the first part is model assumption. Dependent variables must be dichotomous or binary, which are generally coded as 0 and 1. In our study, we coded 0 as no presence diabetes while 1 as presence diabetes. Second is do not assume a linear relationship between dependent variable and independent variables. Category or group must be mutually exclusive or exhaustive. And the last part is larger sample are required than for a linear regression. In our study, we use more than 700 data. Next, we go to the general model. We take general model in our literature review in chapter 2. We apply this general model in our study where Y is dichotomous dependent variable, which is 0 not diabetes presence while Y diabetes presence, and x1 to the x8 as our independent variables, and also Ui as random error term, since Y does not have head in general model function. Next, we go to the model estimation. This is the formula of odds and odds ratio. Odds and probability are related to each other. Odds ratio is represent the changes in the odds being in on the category's outcomes when the value predictors increase by 1 unit. Next, we go to the Walk statistic. Walk statistic is very important because it's to provide the significance of predicted variables in the equation and to know whether it is influenced the dependent variables or not. We use p-value is to compare the significant level. If p-value less than 0.05, the independent variable is significant and influence the dependent variables. But if p-value more than 0.05, the independent variable is insignificant and not influence the dependent variables. Next, we go to the classification. In this classification, we have 3 classification, and this is the formula for the first part. If assign Z to the population 1, if the estimate odds ratio greater than 1, and this is the formula for the second part. Assign Z to the population 1 if discriminant is greater than 0, or from misclassification, this is the confusion matrix, and we use APE, which is apparent error rate for misclassification or confusion matrix. Next, we go to the goodness of fit test. Goodness of fit test is very important to determine or check how well a model fits the data. The omnibus test is to determine whether there is significant difference among regression coefficient. And this is the H0 and H1 to check the model is significant. Less than 0.05, we reject hash null. Then the model is significant. Then otherwise. Next, we go to the Hosmer-Lemaitre test. Hosmer-Lemaitre test is to determine whether the data is a good fit for a logistic regression model or not. For hash null, its logistic regression model is good, and H1 is poor fit data. If the p-value more than 0.05, then the model is the good fit. Next, we go to the Cox and Snell R-square and Nagar-Kekel R-square. It also to provide indication amount of variation that predict variable explained by the model. R-square value are between a range 0 and 1. Next, we go to the result and findings in chapter 4. We proceed to the Siti Najihah.
I will proceed with the result and discussion. This chapter covers the result and finding of the research. Secondary dataset were used to obtain the best model. The model evaluation criteria is fulfilled in order to have an efficient and a good fit model that fitted the research well. First, logistic regression model. Based on the full model coefficient, we can get the estimated model for full model. There are three variables that are not significant based on the p-value, since the p-value is greater than 0.05. Therefore, the three variables were dropped from the model. The reduced model were obtained after dropping the variable. Based on the coefficient reduced model, we can get the estimated model for reduced model. All variable is significant since the p-value is less than 0.05. Next, odds ratio. Odds ratio used to represent the changes of a patient getting diabetes. Based on the full model odds ratio, it can be concluded for every one-time increase in the number of pregnancies, the odds of getting diabetes is increased by 1.131 times. Next, for every millimole per liter increase in the glucose concentration, the odds of getting diabetes will increase by 1.036 times. For every mmHg increase in the diastolic blood pressure, the odds of getting diabetes will increase by 0.987 times. Then, for every 1 mm increase in skin thickness, the odds of getting diabetes will increase by 1.001 times. For every 1 unit increase in insulin, the odds of getting diabetes will increase by 0.999 times. For every 1 kg per m squared increase in the BMI, the odds of getting diabetes will increase by 1.094 times. For every 1 unit increase in the diabetes pedigree function, the odds of getting diabetes will increase by 2.573 times. For every 1 year increase in age of patient, the odds of getting diabetes will increase by 1.015 times. Based on the table reduced model odds ratio, for every 1 times increase in the number of pregnancies, the odds of getting diabetes will increase by 1.166 times. Every 1 millimole per liter increase in glucose concentration, the odds of getting diabetes will increase by 1.035 times. For blood pressure, for every 1 times mmHg increase in the diastolic blood pressure, the odds of getting diabetes will increase by 0.988 times. For every 1 kg per m squared increase in BMI, the odds of getting diabetes will increase by 1.089 times. Lastly, For every 1 unit, diabetes pedigree function increase 1 time. The odds of getting diabetes will increase by 2.4. For classification, based on classification table, the percentage of patients who do not have diabetes that classified correctly is 89%, while the percentage of patients who have diabetes that classified correctly is 58.2%. Therefore, the overall percentage of full model that are classified correctly is 78.3%. The estimated full model is not good for classification since the appearance error rate for full model is greater than 20%, which is 21.74%. Next, based on the classification table for reduced model, the percentage of patients who do not have diabetes that classified correctly is 88.2%, while the percentage of patients who have diabetes that classified correctly is 57.5%. Therefore, the overall percentage of reduced model that are classified correctly is 77.5%. The estimated reduced model is not good for classification since the appearance error rate is more than 20%, which is 22.53%. For goodness of fit test will be presented by
Thank you, Siti Najiha. My name is Fatih Najwa. I will proceed with goodness of fit test. There are few tests need to be conducted. The first one is omnibus test of model coefficient. Omnibus test was applied to determine whether the data from independent variable give better prediction variables. From the table, the p-value of omnibus test was 0, which is less than 0.05 level of significance for both models. We can conclude that there is enough evidence that both information from the independent variables allow for better prediction. Next is Hosmer and Lemichaud test. Hosmer and Lemichaud test used to test the goodness fit for the logistic regression model. Based on the table, full model stated that p-value is 0.43, which is more than 0.05, which is failed to reject H0. For reduced model, it stated that p-value is 0.421, which is exceed 0.05. Thus, it failed to reject H0. In a conclusion, both of the model which are full and reduced are good fit for the data. The last test is Cox and Snell R-squared and Nagelkerke R-squared. Cox and Snell R-squared model was used to provide the amount of variation in predicted variable explained by the model. Based on the table, for full model, it stated that p-value for Cox and Snell and Nagelkerke is 0.296 and 0.408. Hence, both R-squared value, which is total variation of the presence of diabetes, are 29.6% and 40.8%, can be explained by all variables. For reduced model, the p-value are 0.292 and 0.402. Hence, both R-squared values indicate the total variation of the presence of diabetes is about 29.2% and 40.2%, which can be explained by the variables. For the next, conclusion and recommendation will be presented by the next presenter. Thank you.
As for the conclusion, this study used exploratory research to understand the nature of problems, which is estimating the factors that affect the diabetes based on certain diagnostic measurement. By using 760 examples of female patients for at least 21 years old of Pima Indian heritage, logistic regression is implied to determine significant factors affecting the presence of diabetes. The findings revealed that pregnancy, glucose, blood pressure, BMI, and diabetes pedigree function are the significant factors in predicting the presence of diabetes. In order to develop logistic modeling, the omnibus and Hosmer-Lemichaud being tested, where it shows that The information for full and reduced model allow for better prediction. While Hosmer stated that the logistic regression is a good fit for the data. These are the several recommendations suggested to give clearer ideas to the problems. First, plan a healthy meal in daily life where it is important to seek dietitian to help in creating healthy meal plan. Moreover, an early diagnosis through a relatively inexpensive calculation method such as preparing a blood glucose monitor at home. Lastly, exercising and being active to help to reduce weight and improve production of insulin in body. Thank you for listening. That's all for our presentation. Thank you for watching.